Good evening, everyone. A huge thank you for joining us here at the Lanesborough Health Club and Spa tonight. It's so nice to see so many male faces looking back at me, I have to say. Our audience at the Beauty Triangle is 99.9% female, so it's a really nice change of scenery for me sitting up here. I've met quite a few of you by now, I think, but for anyone I've not yet met, I'm Francesca Ogiman-White and I'm the founder of the Beauty Triangle. Now, we're here tonight to talk about men's health. After all, I'm sure we can all agree that there's a huge amount in male health that still goes unspoken. But whether it's acne, scarring, facial redness that are starting to take their toll on self-esteem, or maybe noticeable hair loss that's starting to become a problem. Maybe it's actually wanting to lose a few kilos, or to improve your fitness and your bodily strength, build a bit of muscle mass, or even reduce your stress. All of these things are really key, and we're going to be hearing more from our amazing speakers on how we can physically optimize the body whilst also restoring our self-esteem. Now, when we started the Beauty Triangle, it was to educate and empower our audiences, and always from a holistic standpoint. But it was also to demystify and destigmatize a lot of the conversations in well-being that aren't often spoken out loud. In doing so, we host conversations such as the ones you're about to hear here tonight with three amazing experts. They're always absolute authorities on their given subject matter, because that's something we feel really passionately about, putting genuine information from genuine practitioners out there into the public domain, ideally so that people can make safer and better informed decisions that are ultimately right for them. So, without further ado, I'll introduce you to our amazing speakers that we have here with us tonight. We're joined by consultant dermatologist and medical director at Midland Skin, Dr. Sajjad Rajpar, hair restoration surgeon from the Fajio Institute, Dr. Greg Williams, and former professional boxer and the Lanesborough's own strength and conditioning coach, Irfan Ahmed. And really, they're all here to explore proven routes to physical optimization, whether that be the right skincare to use, for example, or the power of the right hair restoration procedure and medication in the long term, as well as obviously the effects of fitness and nutrition in strengthening both body and mind. Hopefully, all of you will have found a program on your seats. You'll find information on all of the speakers on there, the all-important Instagram handles as well, should you want to follow them. There's also a referral card on the back, so if you'd like us to connect you with anyone that you hear speak here tonight, you can just tick the box next to their name, leave your email, and we'll connect you afterwards. We'll have time for some audience questions at the very end, so we'd love to hear from you if you have anything to share or would like to ask. And finally, we have an amazing goodie bag for everyone here. We've got performance protein powder from our friends at Form Nutrition, and also the latest wrinkle relaxing serum from Revision Skincare, which I'm highly excited about. I'm hoping there's one left for me, so that we can all get started on better skin, hair, and body from the moment we get home. But enough from me. I'm going to hand over to our speakers. They're going to say a very quick hello and introduce themselves, and then we'll get started with the main conversation. So, Saj, over to you.
Thank you. Hi, everyone. It's a pleasure to be here. I'm Sajjad Rajpar. I'm a consultant dermatologist. I run a clinic in Birmingham of 4 dermatologists and 3 surgeons, and we do all things skin.
Thank you.
So my name's Greg Williams. Thanks so much for inviting me. My practice is not 99.9% male, but it's about 95%, so it's lovely to speak to a male audience. So I'm a plastic surgeon by background. I used to run the burns unit in London for a decade, and I've been doing hair transplant surgery full-time now for about 12 years, but overall for about 20 years. And I can assure you that hair transplant surgery, for those who are suitable for it, is absolutely a life-changing game changer.
Are you looking at everyone's heads of hair in this
I
room?
I have already recruited a few, yeah.
Hi everyone, and thank you, Francesca, for the lovely introduction. I'm Irfan. I'm a personal trainer here at the Lanesborough Club and Spa. I've been here for 7 years now, and prior to that I was working full-time with 2 professional boxers in strength and conditioning. And after one had retired and the other had semi-retired, I was looking for a new gig. I walked into this place and there wasn't a better place for me, so now you can find me here 5 days a week, and yeah.
Amazing. Thanks so much, Irfan. Really happy to have you here. So our first speaker is Dr. Sajjad Rajpar. He's already introduced himself, consultant dermatologist. And I think what I love about Sajjad's approach is that everything is very much data-backed as well as being very innovative, and I think always delivered in the interest of the patient, most importantly. But maybe you can start by telling us a little bit about the men who come to your door and what their most common skincare concerns are.
Yeah, we certainly welcome men at the clinic, and we see about 40% of our patients are men. And the most common things that we see in our clinic are acne and the consequences of acne, which is acne scarring. Redness is a big problem in men, and often that's from rosacea. Anti-aging and skincare, and hair loss. I'd say that's our top 4 concerns that we see among our male
Because it's interesting, as a dermatologist, it's not just the skin, obviously, it's the nails and it's also the hair. And Greg is obviously our hair restoration surgeon, but you obviously see a huge sort of cohort of men coming in with the early signs and wanting to understand a little bit more about it, don't you?
Yeah, absolutely. There's a role for us in diagnosing hair conditions, especially when we're talking to young men in their teens or early 20s who are starting to lose their hair and want to start non-surgical treatments and perhaps delay the need for a surgical transplant, or really try and get to grips with what's going on in their scalp. So yes, we deal, dermatologists, many people won't know, deal with hair, skin and nail conditions.
It's really interesting. And so you mentioned acne as one of the key things that brings people to your door. And what are the solutions, I suppose, that you can offer? Because there are so many different ways to tackle it, but it's definitely something that drives incredibly low self-esteem, male or female, to be honest.
Yeah, absolutely. I think acne, a lot of the data shows the quality of life impact of acne is huge. And people are severely affected by having active acne. And you'll be surprised to know, we categorize acne as mild, moderate or severe. And people with mild acne, 20% of people with mild acne will get scarring from their acne. So it's really worth getting acne under control to both improve that person's self-esteem, but also to prevent scarring.
It's so true. And it's such a good point to make, I think, the education on actually tackling acne as soon as you can, because otherwise, like you said, the detriment to one's self-esteem, but that there's so much that can be done if you catch it at the right time.
Yeah, absolutely. I think when I was young, certainly, it was very much the case that, teenage acne is something that you must just let run the course of, just let it run through. But, this condition is a facial scarring condition for some people, and those scars are permanent and very difficult to treat. So really get in there early, and there's loads of things that you can do to help yourself. There are 3 main ingredients that I like that you can get in creams: benzoyl peroxide, azelaic acid, and retinols. And one of those is likely to help somebody with mild acne. So if somebody has mild acne, they might like to try that and see how they go.
It's almost like the first sort of step.
That would be the first step. And what somebody shouldn't do is try and put as many ingredients that they see on Instagram or TikTok. And and this is what we're seeing now. People, when we ask, what's your skincare? We have a booking form. We say, well, what's your skincare? And some people are putting in 8, 9, 10 products in the morning and 7, 8, 9, 10 products in the evening.
Oh my goodness me.
And it's not good for the skin. It's not good for the skin
And it's
barrier.
so much money spent on skincare that ultimately is aggravating the problem even more.
Absolutely. So rule number 1, keep it simple.
Yeah.
Find one ingredient that you can get on with that works for that condition. And that applies to rosacea, to acne, to anti-aging, to anything really.
And can I ask, with the acne, it's obviously not a case that it's just adolescents and teenagers coming in with it, right? Because like you said, we think it's something that is really just, your teenage years, that sort of angst of breakouts and blemishes, but this is happening at a later stage for a lot of people as well.
For sure. So acne starts with puberty. So as soon as a boy or a girl has testosterone, their sebaceous glands grow and produce excessive grease, which can trigger acne. And 90% of boys will get some form of acne at some stage. And the majority of it will clear by the time that they're 18 or 19, but at least 20% of men in their 20s have acne. So it's a significant burden in adults. And I will see adults who say, look, I've got a job in finance, I've got a job in sales, I'm dealing with customers every day, and I've got acne spots on my face. I don't feel like I look like I should be doing this job, and people are looking at my skin rather than me.
And unlike women, who can often sort of camouflage it with a lot of makeup and concealer. I mean, there is that option for men, but it's not something that is as readily done.
Yeah, it's difficult for men.
Yeah.
And it's not practical always as well. And there's also the issue of spots secondary to shaving.
Yeah.
So it can be quite complex, and it can really burden people.
And also, you're right, sort of it's the different areas as well. It's not just acne on the face, it can be on the chest, it can be on the back. It can really sort of inhibit somebody wanting to go to the beach, put on their swimming trunks, I guess, sort of actually live life as they would, go to the gym, wear sort of sleeveless things.
Yeah, absolutely. And again, scarring can occur on the back and the chest as well. Sometimes lumpy scarring occurs. And often people will just not want to take their top off, at the beach or even in front of their partners. So,
that's
it can
so
be
true.
fun. Yeah.
Can you tell us about, so you have a new device called Aviclear, am I right? And that's a really, really interesting new device in the world of sort of acne management and also scar management, sort of somewhat off the record.
Yeah, absolutely. So I started dermatology in 2004, so it's 20 years in dermatology, and I would say that laser treatment of active acne, is the biggest step that we've had in acne so far. And what this laser does is it shrinks the sebaceous gland. So it uses light that gets converted to heat to actually cook and shrink the sebaceous gland. And if you reduce the size of your sebaceous glands, you have less sebum and you get less acne. And the benefit with this treatment is that it's only 3 treatments and there's a 70 to 80% reduction in spots at 1 year. And for some people that can be as high as 90%. So it's really effective.
Amazing.
Yeah, it's transformed our treatment because up till now, once somebody has more than mild acne, the UK guidelines would recommend 3 or 6 or 9 months on antibiotics. And who wants to be on antibiotics? Who wants our children to be on long-term antibiotics? Who knows what that's doing to the skin microbiome, the gut microbiome? So it's a way to avoid antibiotic treatment. And then, if somebody's got very severe acne, there's also a treatment called Roaccutane, which you might have heard of, which is a vitamin A derived treatment, which also shrinks the sebaceous glands.
Okay.
So that's the target of both the laser and Roaccutane.
Would you put somebody on the Aviclear and the Roaccutane all at the same time to really sort of drive that sort of recovery process?
Not usually, because they're both targeting the sebaceous gland. So if you shrink the sebaceous gland with Roaccutane, then the laser will have less to target. So you often want to pick one or the other, but you might complement it with one of those topical treatments that we mentioned.
Yeah.
So often people will be on some form of topical retinoid and be using an Aviclear.
But I just think it's so nice to be able to give patients options now,
Sure.
and that's the key thing, right? Back in the day, there weren't so many options.
No, absolutely. And this is what it's all about. So a consultation really is about trying to give somebody the knowledge as to what there is, what
exactly.
might be suitable for them at their point in life, and what the realistic outcomes are going to be. And then, often people will take that information and then read about all the options and then come back to us and say, right, that's what I would like to do. And that's how we run our clinic.
Yeah.
It's very much patient-driven.
That's really nice to hear. And tell me a little bit about the facial redness. You said that's something else that is a big concern. What is that exactly? Skin sensitivity? Is it rosacea? Is it acne, sort of flare-ups, pigmentation?
It's all the above.
Okay.
So all the above can cause redness on the face, and it's actually quite a common concern among men to come and see me.
Yeah.
And for some people, they've just got a bit of colouring to their skin, and with emotional changes or changes in temperature, our skin will change, and we will get some redness. But for some people, that redness can be very, very strong. It can also be associated with a burning sensation on their face, pain sometimes, and they may even get some swelling. And when they've got those signs and symptoms together, I often will say, well, what are the triggers? And often people will say things like alcohol, a spicy meal. So people won't go out and have a curry or a beer with their friends because they know they're going to go get this reaction on their face.
And that's when it sort of becomes quite sad, whether it's acne, whether it's redness, when I think these things actually start inhibiting how we live our lives and our social lives. I think that can really drive low self-esteem.
Absolutely. The issue is that it affects people's day-to-day lives. And it's something that they can't control. So once they know, my face is flushing, they get emotionally aware of it, and that drives...
And then it's worse.
Oh gosh, and then they're in this positive feedback loop where they can't get out. And remember, we're talking about potentially people in professional meetings or, on a webcam or something like that. And people are very conscious about this. And rosacea is the biggest sort of cause of that sort of group of symptoms. And, it might be as common as 20 or 25% of Caucasian people. So it's really, really, really common.
And what do you do to treat it?
We always start by assessing the skin. So some forms of rosacea get spots.
Yeah.
And if there is inflammation, we want to control the inflammation. And there are some ingredients like azelaic acid or metronidazole or ivermectin that can help the inflammation. For the redness and the flushing, the treatment of choice is laser. Now, different laser to the AviClear, these are what are called vascular lasers, because what you're trying to do is use light to shrink the number of blood vessels in the skin. And if you shrink the vessels in the skin, there's less to
blood,
dilate.
there's less flushing,
blood.
yes.
Absolutely. And the vessels becomes more stable. And there's something anti-inflammatory about lasers, we just don't know why. But you reduce all these inflammatory chemicals that come out of nerve endings that drive the stinging, the burning, the swelling. So you get stability in the skin. And I would say about 70% of people respond to a course of laser treatment, and they then might need maintenance once or twice a year. And so we often see people once a year and say, look, I've just come from my annual rosacea redness maintenance laser. And it's really lovely that they've been
I think,
okay.
yeah, people
for
like
12
to
months.
sort of know what their routine is going to look like as well. If
Absolutely.
there's a routine and there's a plan, for managing your skin, great, sign me up.
Absolutely, absolutely. It gives them the confidence that, this is now under control. It's not going to come back and really affect me.
So when somebody has got their skin under control, when does the conversation turn? Because you also do a little bit of aesthetics. When does the conversation
absolutely.
turn to things like the sort of wrinkle relaxing injections or the sort of polynucleotides? That's a big thing for you now.
Yeah, at any stage, because men are increasingly aware of all the options available to them for their skin and maintaining their skin. And who doesn't want to look after your skin and have healthier looking skin as we get older.
And I'm so interested because you've said the word like skin and healthy looking skin so many times in that conversation, but also that is what it's about. And I feel like sometimes these aesthetic treatments are sort of stigmatized again. They're going to be unnatural results, they're going to look weird, everyone's going to know. But actually, if you're just creating really healthy looking skin.
Absolutely. And I actually don't like the word anti-aging. I kind of said anti-aging at the beginning because that's what people recognize.
Yeah.
But it's not actually anti-aging, it's look as good as you can as you age.
Yeah. So be that best version of yourself.
Be the best. And all our skin, it's going to deteriorate as we get older, right? And so what can we do to improve that as time goes by? And what I say to my patients is, look, if you maintain a simple skincare regime, then in 5 years, in 10 years, in 15 years, your skin will look better than it would have if you didn't.
I'm starting to understand why you say you've been doing dermatology for 20 years and you literally look like you've been doing it for 3.
Thank you. It's been more than 3 then, but you see, and I'm seeing my patients back now, 15 to 20 years now, it has been. And I can tell you, as they walk through the door, I can tell you, even without looking at their notes, that person's on skincare. And when you asked me 20 years ago, do you believe in skincare? I'd be like, come on. Are you serious?
Really?
I would have said, are you serious? Because, I was treating serious skin conditions. I was treating, hospitalized patients. And here you are talking to me about vitamin C and retinol. Are you serious? Are you serious?
Yeah.
But I can tell you, they'll walk through the door and, I have patients now in their 60s. They started with me in their 40s. And I have spouses who didn't follow their skincare, or brothers and sisters, because often in my practice, it's all word of mouth. So people recommend other people. So I see families, and I can tell you who's doing skincare. And, when you continue it for 20 years, that's when you'll see the benefits. So if you buy this new skincare product and next week you think, oh God, it hasn't changed my skin. It's not going to. It was never designed to. And
it's about the consistency. And what is it, 3 months for the skin cells the cycle to turn over?
Easily. But, we're trying to prevent the long-term degeneration of our skin. When you look at the reduction in elasticity of the facial skin, in the first 30 sort of years of life, we get this dramatic drop in elasticity. And that's why, we're prone to facial wrinkling and sagging. And what we're trying to do is just slow the rate of decline. And really, it's how much better will you look in 5 and 10 years. And you're not going to look younger then, you're just going to look fresher, brighter, better. I think that's the way I'd look at it.
That's a very nice way to look at it, I agree. And a very positive note to end on as well. Thank you so much, Saj. That was a fascinating overview of everything. And any questions for Saj that you have, we can come to those at the end. Thank you. So our next speaker is Dr. Greg Williams, and I think Greg, very much like us at the Beauty Triangle, flies the flag for things that are, backed by sort of proper science, and he's very passionate about, I suppose, quashing misinformation as well, which is also very important in your line of work, Greg. But maybe you can tell us a little bit about the impact of hair loss on the patients you see, because I suspect it's not dissimilar to the impact of under par skin, as Saj was saying as well.
Yeah, there were so many times when I wanted to butt into the conversation and, say, but, that's so similar to hair patients. And there were lots of things that I want to chat to you about afterwards. But I like the healthy skin, because we can talk about healthy hair. But I think maybe a slight difference is that when you talk about rosacea or acne, those are kind of blemishes and people are kind of embarrassed about it. You lose confidence because of that embarrassment. Whereas I think with hair loss, what I say to patients and what patients say to me is there's a loss of self-recognition. So you're looking in the mirror and you're not seeing the person that you remember or feel you are, so there's a disconnect. And then that starts to eat away at your self-esteem, and then your self-confidence starts drifting down, and then you don't go to the gym anymore, and you don't dress as well, and you eat badly, and it can be a snowball.
Yeah.
And then you start, when you fix it, the opposite happens. People take more interest in themselves, they're proud.
It's interesting because I think hair means so many things to us, like subliminally as well, doesn't it? You know, it's, you know, are you sort of young? Are you energetic? Are you fertile? Like particularly for women, it's a huge thing as you start to lose your hair. And I imagine it's very similar for men, sort of what a full head of hair actually denotes.
Yeah, I mean, I think there are similarities. I think for women it's about femininity. So if you're a lady and you have temporal recessions and an M shape, that tends to look more masculine, and you'll find a lot of women will wear their hair down to hide those temporal recessions, especially in the perimenopause where you do get thinning in the temples.
But I mean, men do exactly the same, and you know,
Absolutely.
you can style your hair in a certain way, and you sort of realise there's a reason that someone's hair is only ever going over to one side, and they're hiding it.
So for men, I think it's about masculinity, and for women, it's about femininity. And then, of course, we've got trans patients where, and I had a patient this week who wants to have, who's non-binary, wants to have an androgynous hairline, and trying to unpick what does that mean to them? What is that hairline, which is so important to them? What does that mean to them?
Yeah, that's so true. And can you tell us a bit about the patients that you do see? Are they on a spectrum of ages as well?
Yeah, so there's no typical hair transplant patient, but if you're going to group them, I would say there are the early 20s to mid 30s maybe, who are grieving their receding hairline and their maturing hairline, which may not be male pattern hair loss. It's just that M is getting deep and the hairline's going up, and they're not looking like the guys on Love Island. And then
the all importance reference point.
That's the reference. Yeah.
And you know, the perfect hairline is a big thing for young guys. It's a really big thing. And then you've got the sort of 35 to maybe 55-year-olds at middle age, where you are genuinely losing hair at the back, at the front, all over. And maybe they've got the resources now to do something about it. And then you've got the older group. And I'm not going to put an age to that, but
the silver surface.
Yeah, who are maybe their life circumstances have changed a bit. Maybe they're dating again, divorced, widowed, or maybe they're retired and they just want to feel younger than they're looking.
Maybe they have a younger girlfriend now as well, and they've got someone else, you know, nudging them along to your door. I bet you see that, right? Yeah, exactly. Are you seeing a rise in hair restoration amongst male patients?
So I think there's much more awareness. I mean, every day in the papers now or the media, there's some celebrity or personality who's had a hair transplant, and I don't get why it's such big news. But you know, this soap star or whatever has had their hair. So I think there is more awareness. People are more willing to talk about it. But I think in the younger age group, there's been a normalization of seeking hair transplant surgery for that slightly receding hairline, or you know, my temple's gone back by a centimeter. And I think that's unfortunate, because that's in many cases a mistake. And we can go on and talk about managing your hair loss medically, as Saj does, before you even think about having a transplant.
Well, also we're seeing a lot of men go abroad for a lot of these surgeries as well, and I think again that's putting it out into the public domain in a very different way than these surgeries that potentially were done behind closed doors.
Yeah, we have we don't talk about Turkish Airlines anymore. We talk about Turkish hairlines. And you know, you go to Istanbul and the airport is full of men with bandages on their heads. And that's because of two things. One is the price, it's cheap. And number two, it's become a thing. Like, if you want a hair transplant, go to Turkey. And it's got a life of its own, and you know, we can talk about why that may or may not be a mistake.
Can you tell us a little bit about the medication as well, because you're a real advocate for stabilising hair loss before you even get to the route of surgery, am I right? With sort of
Sure.
various
and it's
things
really
you can
important,
explain.
I think, for guys to be educated, and there's not enough education out there. If you go to Sajjad's website, there's fantastic information there about the medical management. So there are two in short, male pattern hair loss is driven by a hormone called dihydrotestosterone, DHT. So you're born with a pattern of hairs on your head that have receptors of that hormone, and then over your lifetime, those hairs will deteriorate. And generally, the hair at the sides and the back doesn't have DHT receptors, so that's going to stay. So if we move this hair somewhere else, it's going to stay. And so the definitive treatment for male pattern hair loss is to reduce the amount of DHT, and there's a pill for that called finasteride. That's a drug, and it comes in different brand names. And that's a definitive treatment. Unfortunately, it comes with a side effect profile, which puts a lot of guys off, so there can be sexual dysfunction or psychological confusion and depression and brain fogs. But that's a very, very effective treatment in about 90% of men, you'd say, to slow down or stop hair loss. And for guys who don't want to do that or take that big step, there's topical minoxidil, which the brand is Regain. It's over-the-counter, liquid or foam. You rub it on once or twice a day, and it is effective, but it's not dealing with the cause of the hair loss. So in my experience, over long periods of time, that benefit will wane off, and the hair will start to deteriorate again. Those are the two licensed treatments. But what you rub on comes as a pill. The pill finasteride comes as something you can rub on, and there are all sorts of other injectable therapies, so you can inject your own blood. There's lots of vitamins and growth factors you can inject. There's microneedling, just rubbing needles on your head will work in some men. There's
exosomes and polynucleotides.
All sorts of things that you can inject. There's low-level light therapy, so lasers and LEDs that you can shine on. And now there are a large group of emerging energy-based devices that work on ultrasound or high-frequency radio waves or lasers. And I think there's a lot of excitement around what these can do.
And again, I'm sure there's an argument for a little bit of everything in combination as well might add up to a really good sort of long-term result.
Yeah, that is a philosophy of some people throw everything at it, and then something in the mix will work. I'm much more an advocate of trying one thing at a time. And you can start with the big bang with finasteride, which is probably going to work, or if you don't want to go there, start with lesser things. But anything you do, this is all dead. Oh, your hair is dead. So nothing you do is going to change what's there. So it's got to affect the cells under the surface. They have to grow through. The hair grows about 1 centimeter a month. So really, anything you're doing is going to take about 6 months before you can notice a difference. And it's very hard to measure hair changes.
Exactly.
A lot of it is subjective, and you forget after 6 months what your hair looked like.
Yeah.
But you have to be, what you want to do is see an ethical practitioner and have a plan. And that plan may be to introduce one thing, see if it works, a plateau. If your hair is getting worse, it's not working, maybe move to something else. If you get a plateau, maybe add something else. But then it depends on the individual. So if I have a young guy in his 20s, dad, granddad, uncles are all balding, and you can see he's balding, really he wants to hit that hard. He can't afford to wait 6 months or a year or two.
Exactly,
for
catch it before it gets worse, a bit like the
worse.
acne and the acne scarring. Who is suitable for a surgical hair transplant and who is not suitable?
So there are very few people who are not suitable.
Oh, that's joyful.
A lot of it will be due to their physical health. So if you're on blood thinners, for instance, if you're a diabetic hypertensive, that might be problematic. There are some medical conditions that would be contraindications. But most people would be potentially a candidate. But it's about managing their expectations. And it's very different to if you have a bent nose or prominent ears and you fix it. That's it for life. You've had one surgery, that's it. Your hair loss is dynamic and ongoing. So the most difficult part of my job is trying to predict how much hair loss somebody's going to have in their lifetime, the degree and the extent. That's impossible in a 20-year-old. Pretty likely you can make an accurate assessment in a 60 or 70-year-old. So every patient's different. When I do a consultation, it's about when do they start losing their hair, how quickly is it going, what's the area of distribution that I can see is going, what's the family history, what's their knowledge base in terms of non-surgical, non-pharmacological, non-surgical treatments. And my consultation takes 45 minutes.
Yeah, I mean, it sounds like there's a lot to get through.
And that we may not even talk about a hair transplant in that.
Gosh, come back for a second one. And what actually happens when you get into the operating theatre? If you are suitable, if you go ahead, you've had the long-term management chat,
so generally,
what do you do?
The length of the procedure and the cost depends on how many hairs we're transplanting. So the hair doesn't grow as single strands on your head. It grows as little groups called a follicular unit, a little family. When we do a transplant, we take that family, we move it somewhere else. We call it a graft. And so there are two ways to harvest the grafts, because remember I said the hair at the sides and back doesn't have DHT receptors. So what's referred to as the old-fashioned technique, which I don't agree with, is called a strip, where you cut out a strip of scalp skin, you close the wound, it leaves you with a permanent linear scar. Then under microscopes you divide that strip into the individual groupings of hairs and you transplant them. I do about 95% of my surgery in men with the other technique, which is called FUE, follicular unit excision, where we drill out the little grouping, so it leaves thousands of little holes which heal with dot scars, and we move those. It's all under local anesthetic, but a procedure can take 10 hours. Sometimes we stretch it over 2 days, 2 days straight in the operating table, 8 hours each day.
And what's the downtime after the FUE, if that's the one that you most commonly do?
So downtime is usually around appearance. So we have to shave the sides and the back, or I do in my practice. Quite often we'll shave the recipient area. So it's about whether or not you're willing to present yourself socially and at work with people.
A lot of working from home going on.
Well, I say to people, be loud and proud about having your transplant. Most guys will have some degree of hair loss, and they'll be interested in it. They'll be fascinated. They'll want to track your progress. And it may be the trigger for them to take a leap and have their own transplant.
That's so true, and the confidence that you get back as a result as well. How do you go about fashioning a very natural-looking hairline? So, you obviously don't want it to then suddenly look like you've had the hair transplant and have everyone asking you.
Yeah, so that's the main thing I say to my patients, and what Farjo is known for is that your transplant should be inconspicuous. It should look completely natural, and it should also take into account what's going on elsewhere. So if you've got a balding crown, you really don't want a low youthful hairline. You need that transplanted hairline to be mature, to have that M shape. And again, there's no typical hairline I design. It's based on the patient's facial features, the degree of their hair loss, their age, their likelihood of having more hair loss. Importantly, how much donor hair do they have to use? Because we can have what's called a donor-recipient mismatch. So got a big area to cover and actually only a small scalp donor. Now we can, in some circumstances, use beard as a donor, and in some cases chest, but generally looking at
but then that hair would behave very differently when it's on the head?
Potentially it can. So it can be useful to add volume where you've already done scalp transplants. You can add beard in amongst that. But you can imagine if you, a Caucasian with fine hair, if you put beard hair up there, you're going to look like you've got a beard on the top of your head.
That's fascinating. The thing that people are always worried about when they ask, or men ask me about hair transplants, is that they'll have it done and then it will sort of start to recede again, and they'll sort of end up with a bit that has been missed, and they'll have the sort of nice low sort of hairline, but they'll be going bald behind that. So how do you rectify?
Yeah, so I predict we are going to have an absolute epidemic of men in the next 10 years who've had inappropriate hair transplants in their early 20s, perhaps in Turkey or somewhere else.
Yikes.
And they've receded behind it because dad and grandpa are all bald. They haven't been counseled about managing their hair loss non-surgically at the same time as having the surgery. So that is, all of that I take into account. I will tell people who I think are going to potentially have more hair loss, you may think about having 2, 3, 4 procedures during your lifetime. So it's a journey of hair restoration that needs to keep up with your ongoing hair loss if you're going to have ongoing hair loss. And again, prevention better than cure. So try and stop your hair from getting worse.
I think that's really important. I see a whole new sort of category of hair restoration revisions almost coming your way in the next decade. It'll be interesting to see how that works.
You can tell a bad hair transplant from a mile away. You can spot it. But a lot of guys will think their transplant's quite good because they have more hair than they did before.
What do you mean? Like, how can you tell it's bad? What are you saying?
Oh, it's just
we're not.
It's
too
pluggy.
perfect.
It's the front line may be too harsh, too pluggy. The density. I see a lot of patients coming back from Turkey where they've got that thick sides and back, and they've thought it's a good idea to just give light coverage over the whole top with a lower hairline. You can spot it a mile away. But a lot of guys will think they've had a good transplant because they have more hair. So the angle and the direction isn't great, and the density isn't great, but they can style it. They can use products, they can hide it. Whereas a great transplant, your hairdresser really shouldn't know you've had it done.
That's the litmus test, really, isn't
Absolutely.
it? Amazing. Thank you so much, Greg. Really fascinating as always. I could talk to you for hours about hair. And I don't even need the hair transplant yet. So our final speaker is Irfan Ahmed. trainer, personal trainer, boxing coach, strength and conditioning coach here at the Lanesborough. I actually trained with Irfan before my wedding, which is how we got to know one another. And this guy can get serious results in the gym. So yeah, really excited to have you.
A lot of pain
Irfan.
comes with that also, doesn't it?
No, not at all. You're excellent. There's always a nice protein shake waiting for you at the end as well, which is always very happy making. But tell us, why are most men coming to your door? What are they seeking to gain from their fitness when they come to train with you?
I think most men would come into the gym to build muscle and lose body fat. I think that's everywhere across the pond. But the problem is they only have an hour a day to get that done. That's the real issue here, because the most effective way to lose body fat and build muscle is training twice per day, but it's not practical.
Oh my goodness, I barely clock in once a week. I
It's
mean,
very
I wouldn't do
difficult.
very well with your program.
I mean, I'm a trainer, I'm in the industry, and sometimes I find that difficult myself. So I'll go into a bit more detail. So what you would do is you would do a steady cardio session, a very low intensity zone 2 type cardio, whether either early in the day or later in the day, but about a 4 or 5 hour difference. Then you'll train, you'll do your strength training session later or early in the day. What this does is it allows me, if I'm working with a client, to really focus on building the muscle and not focusing on so much getting a calorie expenditure.
Because I guess that's what a lot of people are constantly chasing, right? You want to drop the body fat, so you're eating less calories, you're fasting. Fasting is a big thing at the moment as well.
Fasting is good and bad, so it depends. If you're trying to build muscle, I would say absolutely no.
Yeah.
You want to be full of glycogen. You want to take the right fuel into the workout to get a good workout in. I'll go back to the question about what the most effective ways to lose body fat are. I mentioned the training twice per day. But if you can't then do that, I follow a 40-20 rule, which is where you do strength training for 40 minutes, followed by a cardio burst with a bit of core incorporated. Now, what happens here? If you're able to do this consistently, and of course be in a calorie deficit and follow all the other protocols, you will then, if it's structured properly, that first 40 minutes, you will burn all your muscle glycogen. So then that 20 minutes that follows, you'll be burning body fat.
Burning fat, exactly.
So that's the most efficient way to do it in 1 hour. And that's probably what I'm doing with most of my clients.
That's so interesting. And do you find that you have to change up someone's training regime as they start to age as well? Does our workout have to shift over the years?
It really depends, because it depends how well trained they are. So if it's someone who's been training their entire life, not much has to change if they're sort of approaching their 50s and 60s. Maybe a slight focus to more functional fitness rather than trying to chase maximum strength or trying to jump as high as they can.
Yeah.
However, if it's a new trainee and I've had them for about 4 or 5 years and they're sort of now coming into their 50s and 60s, there's some exercises I would avoid. Any exercises that would heavily compress the spine, like a heavy back squat. It's a great exercise generally for the younger population, but for someone who's a bit older, they haven't built up that rigidity and core stability. So I would opt for more single-legged unilateral exercises. For those of you that are working out, that's a Bulgarian split squat. Horrible thing. horrible
I have no
thing.
idea what that is, but it sounds horrid.
I have a client at the back that's just nodding at me. As I mentioned, that we actually had a class today. Thankfully, we're doing a talk instead. But you get equal results, if not even better, from you working the legs unilaterally.
And when you say unilaterally,
one leg at a time.
Okay, yes, God.
And
Just
also,
making sure
as
we're
we
on the right page.
age, balance and stability is really important.
Yeah.
So you get a lot from working one leg at a time rather than two, as for the elder population.
And mobility, I guess, as well, must be a sort of key thing as well, because if we haven't done as much exercise over the years as maybe we would have liked, busy careers, families, juggling too many things, then you're going to be stiff when you come into the gym as well.
Yeah, mobility is crucial, and I'd say that stay on top of your mobility before it's too late, because you're going to have to really do extra mobility sessions, which aren't fun. So a simple way to do that, I mean, there was a big trend, I think maybe in the last sort of, not so much recently, but in the last 5 years and 5 years before that, that you must do mobility sessions on their own. It's not actually the truth. If you train, strength train, the muscle through its full range of motion, if you think about it, that muscle is fully lengthened and in a stretched position. So just doing, for example, a squat all the way down or a lunge all the way down, that's the best mobility exercise you can do. So if you incorporate that earlier into your training career, you'll be fine as you get older.
I'll be doing this as soon as I get home. Where does nutrition fit in? Because obviously there's this adage, isn't there, that actually it's sort of like 80% what you eat and 20% what you do in the gym. And I know that you're very into sort of the clean eating and the eating correctly, but is the sort of nutritional aspect something that your clients struggle with?
I think nutrition is something that everyone has struggled with at some point in their on their journey. Trying to find the right balance, trying to figure out how many calories you should be in deficit, how much you should be eating. We've all struggled with it. I know even I struggled with it in my early years. A common mistake, which I can tell you about, is someone will come into the gym, they want to lose a ton of body fat in the fastest way possible. So they'll really restrict their calories. Their protein will be really high, but they won't be eating any carbohydrates. There'll be no fuel for the workout, and by the time they met me in the gym, they're completely spent. So it means
we've really
less output.
demonized the carbs,
Yeah, they're just
haven't we?
hobbling all over the place, not being able to concentrate. So there's less output in the session. Then what would happen? They will get home. If they haven't planned their meal, it's
Game over.
Game over. I've been there myself.
Fridge raiding.
So I think it's important to have a plan, knowing what you're going to eat, especially if you're going to severely restrict your calories, which I don't recommend. It does work if you need to lose body fat quickly. Have a plan, know what you're going to eat when you're going to go home.
And on the note, can we talk a bit about alcohol at this time of year, forward planning, what your evening might look like? There's a lot of champagne going around this evening. What are your thoughts? Because again, we know, like, obviously, the less alcohol we can drink, the better the results will be. But also, we've got to be realistic with the fact that we all have social lives to live. So how do you manage that for your patients who are still trying to build muscle and lose fat?
So it's a really good question. I think Dr. Greg and Dr. Sajjad are going to really hate me for saying this, but I'm going to talk specifically from a strength perspective. Not so much from a health perspective. So having a glass of alcohol every day, a couple or 2 glasses of red every day, and if you're strength training also, can be very detrimental. You will probably lose, or I should say your strength gains will diminish by 10 to 30% from just those 2 glasses of alcohol daily. So if you think about it, by day 5, that's a lot of gains lost in the gym. Now,
especially if you're exercising like twice a day and you're really like trying to...
So what I tell my clients and what has worked is I'd rather you have a big night on the weekend rather than a consistent few glasses of alcohol every day, which are going to be detrimental to your goals. Ideally, don't do both. Don't do either. Honestly, don't do either. Don't do either. Don't drink at all. But
and if we do drink, what is it, like clear spirits? That's what you guys
I'm not
say.
a big drinker myself. I'm not an expert, but I would say the ones that have less sugar in them. I guess you guys would agree with that, just from a fat loss perspective.
Yeah, exactly. And where do things like the, enhancing your workout with caffeine or taking the protein powders, what are your thoughts on sort of using those to sort of support the training?
So caffeine has so many advantages, but I'll talk about the cons before. So taking caffeine first thing in the morning, I always tell my clients not to do that on an empty stomach.
Okay.
You slept all night, your cortisol levels are already pretty high. Then you're going to double down on that and have some caffeine. They're going to spike further, and then they're going to chronically stay high for a longer period of time. It's going to take a long time to get that cortisol down. So I always tell my clients to either to eat something first, maybe wait an hour and a half, then get that caffeine in. I know most of you guys are not going to do that, but
I know, I'm thinking I have to have an espresso to get out of bed.
Yeah, exactly. But I'll throw it out there anyway.
And what about? Do you have anything else to say about coffee before I ask you about protein? I feel like I've got lots of questions for you.
As a performance enhancer, so to get the best out of coffee, you would have to have 0.5 milligrams of caffeine per kilo of body weight.
Wow, okay. How do we figure that out?
So if I weigh 50 kg, you would need 0.5 milligrams times 50.
So we just need to measure that all
Yeah.
out. But what does that roughly
So about-
equate to?
I would about 100 grams,
Uh-huh.
100 milligrams per caffeine
Mhm.
on average before your workout would be great.
Okay.
For an
interesting.
athlete, maybe more, 180 to 200 milligrams.
Yeah, because athletes, you sort of like deprive them of the caffeine
Deprive
as
them.
well, don't you?
What the athletes used to do was, what's interesting, when I was working with the fighters, they would stay on caffeine until it's fight week. And then they would have a deload week where they would not take any caffeine until it was the fight itself.
Mhm.
So half an hour before the fight, to get supercharged and
Oh my
go
God,
at
that
it.
must be crazy. I should do that when I've got one of these events. No caffeine, and then like half an hour before. Wow, imagine.
With the adrenaline involved
Yeah.
as well, it
And
works very well.
And can I ask you about protein as well, as we're talking about things to ingest and sort of what's suitable? What are your thoughts on like protein shakes? I mean, you mentioned you've got to have adequate sort of protein intake when you're training to build muscle. Shakes, bars, sort
Yeah,
of.
so
how do you
from
do
a
it?
strength training perspective, it's very difficult for us to get the right amount of protein in our diets because of our lifestyle. We're all working. It's not possible to get four solid meals that have protein in a day. If you can, then that's fantastic. But so more often than not, I'm telling my clients to supplement with 2 shakes a day if they're then able to have 2 solid meals per day. Now, as for the protein itself, the best protein out there the best protein for building muscle is hydrolyzed whey protein.
Mhm.
It absorbs very fast, and is also pretty good for people who are lactose intolerant. There's one called dimetized ISO 100, really good protein, great digestive enzymes, and even some of my clients who are lactose intolerant do fine with it.
That's
Another
interesting.
protein I recommend to my clients is a casein protein. I'm sure most of you guys who do train know about this. So when you take casein before sleeping, so it slowly releases throughout the night because you're in a fasted state. It works really well.
Very interesting. Can I ask you a little bit about the emotional health benefits of exercise? Do you see that coming through when you train men here in the gym? Like, is it the outlet that we always talk about, physical exertion being sort of on a mental health level?
I think it works. I think strength training works really well for emotional health for guys, especially. Why? Because men generally don't tend to speak about their problems. They don't want to speak about their day or any difficulties they might be having. And usually, as we know now, that's actually quite healthy, but we won't do it. So I think strength training is a great outlet. It's also a change of scenery also. They can forget about the things they may or may not be having, may not be going on in their lives, and it's a great outlet.
I guess as well, if things are not going so well in life, sort of work, career, families, relationships, it's a nice sort of, I guess, like you said, a change of scenery, but it's nice to feel that you're maybe getting sort of results from your body in a physical level, if nothing else.
Exactly, and I think it's one of the few things that's in our own hands. There's some things that are beyond us, but what we can really look after is our health and fitness. So
I agree.
and you get a feel-good factor at least knowing that you're on top of that.
Yeah, I agree. And tell us a bit about the boxing as well, because I've done a bit of boxing with
Yeah.
you, and it's an amazing sort of release, sort of energetically, emotionally. But do you find that again, is that sort of a valuable part of your sort of male clients' training here as well, the boxing?
I think there's so many good lessons that you can take from boxing. So when I used to box, when I was young, I used to see young kids come into the gym and they used to have a lot of anger. And every time they'd get punched in sparring, they'd respond in anger, then get punched again. Then they'd have to learn that responding in anger is not actually the right way. So you have to think about what mistake you made. You have to make tactical cues, and it actually helps you. It helps you control your anger and think under stress situations.
Yeah.
And I think doing boxing helps you really help with that.
Because that's interesting. I think a lot of people would think, I've got a lot of anger, I need to box to almost get it out, but
It never works.
Yeah.
It doesn't flow well. I mean, I think you mentioned earlier about the dancing. It's boxing is all about rhythm. As soon as you get tense and you start punching too hard and your movement's off, it might sound really good on the bag. Oh no, he or she is really killing it
You
on
can
the
always
bag.
hear it on the other side of the gym. You're like, whoa.
But is it actual good boxing? Is it? It's probably not.
Yeah. And you're right. So I was saying that actually I used to do a lot of dance, and I found when I did boxing there were a lot of similarities. Because you go into that very meditative state. You're following sort of instructions and routines and rhythm, and it does flow. And you sort of just I guess that's why they call it like rolling with the punches, right? You literally just go into another zone and another space. And I think it's such a powerful outlet for people to be able to have in their lives if they do it correctly and under the right supervision, obviously.
So powerful now. I mean, I think it saved so many lives also. I mean, if you think historically, all the top boxing gyms in UK are in rough neighbourhoods where you've got kids coming in from troubled backgrounds, and I think it's helped them think from a different perspective how to control their anger, and I think it saved lives, really.
Yeah, I agree. Oh, also a very empowering note to end on. Thank you so much. Thank you so much, Irfan.
Thank you, Francesca.
So that brings us to the end of the discussion tonight, and I think it's so fascinating listening to each of you. Honestly, I've really loved sort of hosting this talk tonight. It's different, men's health to probably what we might normally be talking about, but whether it's dermatology, whether it's hair transplants, strength and conditioning training, I think you're each tapping into such areas of expertise, and the results are obviously phenomenal when sort of followed under your supervision, but they're all so incredibly linked to self-esteem and emotional well-being and mental health. And I think anything we can do where we get the physical gains but also the emotional gains is a really powerful pathway to be on. So thank you to all of you. We've got time for questions if anyone does have any questions, but if you would not like to put up your hand and ask, then I'm sure our speakers will all be around as well. No, we must have covered
Any
everything.
questions about Bulgarian split squats? Or anyone would try? I can.
The gym is still open.
Just next door. If anyone.
Just saying, if anyone still wants to go.
Better than burpees.
Yeah, I agree. Yeah.
Well, if there are no further questions, then all that's left for me to say is a big thank you to the Lanesborough for hosting us so beautifully as always, and to all of you for attending. I hope it's been helpful and informative, and I don't know about you, but I've learned a huge amount from these gentlemen up here.
Thanks.
So a final big thank you to you guys. That was incredible. Really appreciate it.
Thank you so much.